Now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on Sea Isle 650.
Is there a doctor in the house by any chance? Hello and welcome to Boomer Life here on Sea Isle 650 as we are going to talk about your health. And by gosh, there is a doctor in the house. It's always a real pleasure to welcome Dr. Paul Zickler to Boomer Life. Dr. Zickler is the medical director at YesWellness.com. He's been an MD for over 4 decades and brings a wealth of knowledge and experience to the Yes Wellness team and to our listeners here every appearance on Sea Isle 650. Dr. Zickler, swell to have you back, sir.
It's good to be back too, Sterling.
Tell us a little bit about your background. I said 4 decades as an MD, a couple of them, almost 3, spent as an emergency room physician at Royal Columbian Hospital in New Westminster. Back in the day when that was not a specialty, you were a bit of a pioneer of the emergency room, what is now a part of medical schools.
Yes, absolutely. And you know what? It was very interesting because the emergency department that I was a major part of the committee in developing back in the day when I first started was state of the art. And just this past weekend, I was there to be at the opening of the new trauma center in the emergency department, and so I went back to see what the state of the art is now.
Right.
And so if you can just picture it, so over here to our left is our room that was the state of the art room then, and it was made for 2 beds, and there were 4 beds in it.
Okay.
And it was absolutely cluttered with every inch of equipment and supplies, and of course patients.
Of course.
Okay. And over here was the brand new trauma center. Expansive, light, really bright, with all these control panels that are coming from the ceiling that can be moved around easily, with a built-in X-ray right in the room, so you can move it over all 4 beds.
Fantastic.
It was really the state of the art. And then they had a mannequin on one of the stretchers with one of the new Lucas II cardiopulmonary resuscitators. So they just plunk that on if somebody has had his heart stop, and they just put that on him, and it starts pushing away on the chest, so you don't have to have 2 or 3 people taking turns pumping chest.
CPR, right?
Yeah, doing
right.
CPR, and it was really neat. And it was really neat because there were some nurses there that were still there from the time I was in the emergency department. In fact, one of the girls that cut the ribbon for the new room was there when I started. So it was amazing, that she was still there.
Sure, yeah.
And then relive the changes from that time until now.
I'm just curious, some of the stuff that you've just described to us, back in the day when you and your colleagues were essentially creating the emergency room, were these the kinds of discussions and wild, crazy dreams that you talked about that now, these many years later, are fact? Or did it even go beyond that?
Oh, I went beyond that.
Is that right?
Okay. It's way beyond. I mean, now, the new residents, they have their own portable ultrasound machines.
Oh, boy.
And so back in the day, say, for example, I was looking at an abdomen thinking that with a trauma victim that may have had blood in their peritoneum. We would do this very barbaric test now. We had to cut through their abdomen and stick a tube in, run in a bunch of fluid, and then collect it all, and then look to see if there's any blood.
Sure.
Well, now they just take this little ultrasound machine, go, and there it is.
No invasion, no nothing.
There it is, and this is bruised, and this is swollen, and that's amazing.
Fantastic stuff. Now, some of those colleagues that you formed the emergency department at Royal Columbian with went along with you after you decided to leave after decades of service, and you got into a sort of a minor recreation of emergency clinics in the form of walk-in clinics or wellness centers out in the Langley, White Rock, South Surrey area.
Yes, we did, and it was a good transition for us because we were getting tired of the night shifts, and also the fact that we were hampered by doing our medicine because of overcrowding,
Sure.
and which, by the way, is worse now than it was
I was
then.
going to say, I doubt that's improved at all.
And so we envisioned a place that would be like a step down. So we had a suture room, plaster room, acute care area where we had quick visits, and then referred everybody back to their family doctor.
Right.
And we thought that would be a great way to reduce some of that backlog, and also have access to a care where if you couldn't get an appointment to take care of acute problem.
Sure.
And it worked out well until we expanded and we needed to have more doctors, and to get doctors with the same amount of experience and exposure to that kind of medicine was difficult to find.
Right.
And as well, on the other side of the coin, trying to get a referral back to the family doctor in the right amount of time was difficult, and people just said, oh, the heck with that, I'm just going to go back and fix the problem there.
Sure.
So now we've, now in terms of a walk-in clinic, they've got their family practice orientated with open appointments for walk-ins.
Yes.
That's the trend now.
Yeah, new patients welcome. You see it on the signs a
Yeah,
lot.
and then also walk-ins welcome. So the way they're booked is that they've got so many booked patients,
Yeah.
and then leave space for walk-ins. And then you have a sort of a continuum of care. And then so you know that if I've got this problem today, I've initiated with you, that I'm going to come back in 2 weeks to review all my results and be re-examined and be taken care of if I don't have a family doctor.
Right. And in those early days, you found yourself with these new South Surrey, near the U.S. border locations that you and your colleagues had set up. You found yourself all of a sudden administering your medical services to quite a number of Americans who would come up across the border. And that led to a very interesting discovery, because Americans started recognizing very early on the vast difference in pricing between prescription drugs in Canada and in the United States. The American media got wind of what you were doing, just helping out people from upstate Washington usually with their problems and getting their meds and all the rest of it. But they were rapidly discovering that they could actually afford their medication, take the proper doses. The Seattle papers got wind of it, and all of a sudden you became very popular, to the point where you went into business on the internet with the whole prescriptions by mail thing. That I bet you were probably among the most surprised people with that turn of events.
Oh, absolutely. It's really amazing to think that there would be such a vast difference in the price of medications.
Sure, yeah.
Just south of the border.
Mm-hmm.
And that condition remains to today. The price of medications to Americans is much higher than it is on the average for us.
Oh, true.
And if you remember at that time too, Sterling, the exchange rate was vastly in their favor, $1.65.
Right, and
So
it's leaning in that direction
it's
more and
starting
more
to-
by the
exactly,
day.
that's why-
It's
that's-
under 80 cents
That's
now.
why I bring that up,
Sure.
because not only are they say now probably on the average they're saving probably 30 to 50%. At that time it was 70 to 85%.
Yeah.
But now with the exchange rate in their favor, they're that much better. So that condition still continues, and that's why the online pharmacy industry is still working and is still in demand. But what was interesting during that time is that my daughter became a naturopath, and she in that it sort of made me open my eyes to other kinds of medicine rather than the conventional medicine.
Right.
And I became really interested, and from that led on to sort of looking at sort of complementary therapies and looking at other avenues of treatment, including nutraceuticals and supplements and wellness.
Right.
Rather than spending my time prescribing pharmaceuticals for symptoms of the disease, focusing now, okay, what was the cause of that symptom, and can we treat that cause, and even better still, can we even go a step further and prevent that condition from occurring?
Right.
And that's what got me interested in Yes Wellness.
Okay, and that sort of preventative mindset it does represent a way of thinking in medicine that is not necessarily orthodox Western approach. Is that we deal with symptoms because we're the patients here, those of us listening to you right now, and we generally don't think about going to the doctor until something's wrong.
Yes.
I hurt, I ache, something's wrong. Then it's time to go see the doctor. Whereas you would very much prefer us approaching our lives the way a lot of traditional Chinese medicine doctors and other practitioners do, which is the holistic preventative approach. Be smart, be healthy, and stay healthier.
Yes, yeah, that's for sure. And there's no doubt that the trend of development of medicine, conventional medicine, is going in that direction.
Mm-hmm.
And we've spoken a few times earlier about holistic medicine or functional medicine, integrative medicine,
right?
Where all those where we're looking at conventional doctors that are looking at other avenues of medicine. And I say medicine because it is complementary, but it is medicine.
Mm-hmm.
And some of those medicines and their techniques and their thoughts go back centuries, many centuries.
Mm-hmm.
And there are very intriguing benefits to their treatment. And how can we work these things together to create a treatment plan that's going to keep people healthy?
Right. Tell us about yeswellness.com and how what you've just said about how your thinking has changed and how the medical community's thinking, particularly the traditional Western, the kind of medicine that you took as a student, how even today's medical students are thinking differently because there's a bigger picture for them to appreciate while they're going through school.
Well, yes, and that's exactly why that sort of trend towards looking at the integrative style and focusing on the prevention of the disease,
exactly,
and empowering the patients to take care of their health.
Mm-hmm.
So it creates a partnership between the physician and the patient. I'm the physician. I'm helping you stay healthy, and we're going to work together on this. And it's a completely different focus, because my focus when I first started was, these are the symptoms you're having. I'm going to give you this medicine, and I want you to do this.
Right.
And that's it. And see me in a month.
Mm-hmm.
Whereas now it's, let's look at what we can do to make you stay healthy. And here are some of the things we can do. And I'm going to empower you to make that decision that, yes, are you going to buy in? And I'm going to be part of this treatment plan.
But it is a two-way street, isn't it, Dr. Paul? Because while you, the physician, have changed your approach and your way of thinking over the years, we patients also need to, because, you know, the part that used to drive you crazy was you'd say to me, sitting across the table from you, take my blood pressure, check me out. You'd write a prescription for whatever I'd come to see you about, and then you'd say something like, well, Sterling, you need to lose 20 pounds here. You need to exercise a little bit more, and for crying out loud, stop smoking.
Yeah.
And all I want is my prescription. And come back and see me in a month. You'd say, thank you. Can I have my prescription now? See ya. And all I want is that prescription. I want to get rid of the irritant that caused me to go to you in the first place. And I'm really not paying a lot of attention to dropping 20 pounds or quitting smoking or any of the other wise advice you've given me, because that's not the way we think. We don't go to the doctor until something's wrong. The doctor gives us a pill, and we're okay again.
Yeah.
So patients need to change their approach too. It is a two-way street.
Yeah, absolutely.
So
yeah.
How about yeswellness.com in the context of helping patients to change their way of thinking?
Well, this is where education is a really strong component of it, and making people aware of what they can be empowered to do. And so Yes Wellness is very strong in terms of educating people in creating, in looking at their health and creating wellness. In addition to being able to, if they really feel that they need to have some supplements and nutrients and some say powders and things that are protein powders
Yep.
that they need as part of their program, that they can get it in a location where all the products have been vetted to be of good quality.
Exactly, and that's terribly important.
Yeah.
One of your previous visits, we had a lot of fun with a list that you brought along that was entitled 10 Things to Throw Away for Better Health. Number 10, surprisingly, the last thing on that list turned out to be your chair. Dr. Paul says, get rid of that chair and your life will change dramatically. We'll find out about why. We'll talk about some of the excuses, and boy, are we good at creating those.
Yes, we are.
That we would see as reasons, not excuses, for not being more active. It's all about getting active. And we have a surprise guest to introduce you to a little later on in the program as well. It's Boomer Life on CIL 650. Our guest, Dr. Paul Zicler from YesWellness.com. Back with lots more right after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.